Hi there, my name is Raj Chovatiya. I'm an associate professor at Chicago Medical School and founder and director of the Center for Medical Dermatology and Immunology Research in beautiful Chicago, Illinois. I'm joined today by none other than Dr. Dawn Eichenfield. Would you like to introduce yourself?
Thank you. I'm Dr. Dawn Eichenfield. I'm a pediatric dermatologist at Rady Children's Hospital in sunny San Diego. I'm also assistant professor of dermatology at the University of California at San Diego. It's exciting to be here today.
Well, I think that you're the perfect person for our conversation topic today, all about thinking about topical JAK inhibitors. What can they do for us? What have they done for us? What's their potential in atopic dermatitis? A disease I know you and I both think about a lot, treat a lot about, learn and research about. And I guess maybe my big first question for you, what has been the impact of really novel targeted topical treatments like JAK inhibitors for your patients, particularly the young ones with atopic dermatitis?
I think it's a truly amazing time for atopic dermatitis. Not only do we have new systemic treatment options, but we also have new topical non-steroidal agents, the new ones, not the old ones, that work better and also are not as, burning sensations when you put them on. So it's definitely a good time where we no longer have to rely solely on our topical steroids to treat focal areas of eczema.
And, I think that we have no real argument against the fact that topical steroids serve an important role in our ability to treat patients across a variety of inflammatory diseases. But when we really think about atopic dermatitis and what it means, right? Chronic disease, high burden of itch, involvement of a lot of very sensitive and highly cosmetically important sites. And we think about the fact that our goals for atopic dermatitis have evolved, right? Most of our sets of guidelines have put forth this idea that we should really be aiming for high itch improvement or people being relatively itch-free, fast response, deep clearance of skin itself, a treatment that can allow you to not have to use it all the time to be able to maintain that response. When you think about topical JAK inhibition, it starts to really check all of those options. And maybe I can kind of ask you and pick your brain a bit. What is it about thinking about a JAK inhibitor in topical form that allows us to maybe achieve some of these higher level goals we've started to set for ourselves?
I think topical JAK inhibitors really help AD very quickly. So the quick onset of action, the fact that they help with the itchiness really quickly, that's also very important to my patients just because a lot of them, what predominantly bothers them is definitely the itch. They work really well. They are very strong, but also very safe. And then they're safe also for long-term use. Like we don't have to worry about steroid atrophy that we might see when we're using stronger topical steroids for long periods of time.
Yeah, and I think that you can use some of the data we've learned from topical ruxolitinib, one of our first approved JAK inhibitors in a topical form, to really kind of inform some of those points, right? We have really cool data that suggests within minutes of use, people are having itch improvement. We have data to suggest that people can actually have very high degree of improvement, even beyond just the mild disease that we think about with topicals, but even people with more moderate disease that might be systemic eligible. And for the long run, we know that people don't even have to use it every single day. And some of the longer term studies suggested maybe people used it about half the time they didn't need to, and they managed to maintain that response. And I think that when really delving into this point about that moderate patient that could be eligible for topical, they could be eligible for systemic, it's a hard discussion, particularly in the pediatric world, but really any of them. How do you feel like topical JAK inhibitors have kind of bridged that gap and allowed us to maybe even think about delaying systemics for our patients?
I think there are lots of patients, like you said, they're moderate patients. They could go either way. And in the pediatrics world right now, we only have one systemic agent that's available that's less than 12 years of age. And for those patients, some of them are very needle phobic. So being told that you have to do a shot every 2 or 4 weeks, it's very hard for them. So when that's the case, we usually will introduce something else to see if we can get that atopic dermatitis under better control without progressing to have to need a systemic agent. And I also think a lot of families feel more comfortable with that at times because still you're using a topical medication, and to a lot of people that seems a little less dangerous, so to speak, even though most of our systemic agents are very safe. So I think there's really no no doubt about that. But I think sometimes there's a little bit more coaching that comes about when we have to start a systemic agent.
Yeah, you took the words out of my mouth. In the world of JAK inhibitors, really, there isn't much argument we get on the efficacy piece. And it's usually related to the idea of thinking about the safety piece. And with topicals, I feel like a lot of that discussion is really easy because we don't worry about much. And honestly, even in the oral world, it's evolved quite a bit. And I think that we're able to have a very balanced and fair discussion that generally puts efficacy above even thinking about that safety piece. But I really love the way that you put it, that we have these patients that fit in this bucket of, they're relatively extensive, they're relatively severe, but they really are not interested in an injection or a pill. And so I think topical JAKs have really found a natural home in my practice in that way too. Maybe I can get a closing thought from you on sort of really, what do you think is the future for topical JAKs in atopic dermatitis?
I think that one thing that I would like to see would be trying to lower the approval age for topical JAKs. I think we're always looking at better medications for our patients who are less than 2 years of age. So that would be really exciting if that's a possibility. I'm really looking forward to some of the vitiligo studies. And I think that will be very exciting to have another option for our younger patients who have vitiligo. I'm also looking forward to some of the other studies that are in more phase 2 clinical trials, maybe looking at treatments for maybe topical treatments for HS and other things that are along that line. So I think the future is very bright for our topical JAK agents, and I'm very excited about what the future is going to bring.
I love it. I'll make one more plea for anyone listening out there too. I'm really excited for how far can we push our topical therapies for our patients with more severe disease. And knowing that we've had some of our first clinical trials that focus just on moderate patients, can we really start to think about moderate to severe patients that if a cream is appropriate, will they be ones that we don't have to think about systemic therapy? With that, a big thank you, and thank you to you.
Thank you.